Hey there, what is up, everyone? Welcome to Revolutionary Health, the show about Black gay men's health and overall wellness. My name is Johnnie Ray Kornegay III, and I am so happy to be with you this evening. I'm sitting in, and I'm happy to be here. It's been a while since I have been on Revolutionary Health, and want to definitely give a shout out to our host, Michael Ward, as well. So thank you so much for all the work that you do, Michael. And I am hanging out and sitting in for Michael this evening. So definitely go ahead and check out CNPTV. CNPTV is where you can check out all of the archived episodes of Revolutionary Health, as well as all of the other amazing programming from CNP, including our program, the Gay Man's Guide to Dating. So you can check that out on CNP TV and follow us on social media at CNP Tribe. So on Instagram, Facebook, and Twitter. So excited about tonight's conversation, and I have this amazing guest who I'm going to have with me this evening, and I'm going to read their bio, and then we're going to bring them into the conversation. But before we get started, please, 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 this is live. Bring your comments, bring your questions into the chat. So you can certainly type something to us. We will try to get to as many questions and comments as we can as we go through the conversation this evening. But I'm going to introduce tonight's guest. So the amazing Malcolm Reid is joining me tonight. Malcolm is the founder and program manager of the Silver Lining Project and co-author of the Silver Skills Curriculum. He is the co-founder and co-director of PSAN or PASAN, the Political and Social Action Network. He represents Thrive SS on the U.S. People Living with HIV Caucus Steering Committee, where he is co-chair of the Federal Policy Subcommittee. He also represents County District 2 on the Fulton County HIV/AIDS Care, Prevention, and Policy Advisory Committee. In his role, he also represents Thrive Support Services on the SAGE HIV and Aging Policy Action Committee. With that, I am going to welcome the Malcolm Reid to join me. How are you, Malcolm?
I'm great, Johnny. I'm so happy to be here. How you doing?
I'm doing good, and it's great to see your face. It has been a little while.
It has been a little while. We still got to get a couple of dances in after this
We oh,
COVID.
that's another show, y'all. Me and Malcolm we got to talk about dancing. I miss it. So um, we're about to have a conversation about an incredibly important topic. We're going to talk about a lot of things tonight, but we're going to anchor this topic around talking about the meaningful involvement of people living with HIV. Such an important concept. And so, where I want to start this conversation is if you could frame for us and talk to us a little bit about what MIPA is. So it's MIPA. Tell us a little bit about what MIPA is and the kind of things that MIPA helps us to do in our work.
Yeah. So before we get to that, just a little update about me. I am now the director of programs for Thrive SS. Got a little promotion after starting the Silver Lining Project. And I also was recently appointed to be on the advisory board for the Metropolitan and the Epidemic Advisory Board. So just those two things that I'm adding to my plate. But yeah. So MIPA, meaningful involvement of people with AIDS. It was people with AIDS when it first started. We now say meaningful involvement of people with HIV/AIDS. And basically, to frame it in a quick sentence, nothing about us without us. The principle of MIPA does two things for people living with HIV. It recognizes the importance of the contributions we make as people living with HIV, and it centers our voices in our care and support. So we want to make sure that all the services that we receive, from medical services to psychosocial support to housing, all of those things, whether they are federal policy exchanges, whether they are things that are done at the local government, in your local Ryan White, Part A, Part B, whatever council, that the people living with HIV have a voice about what our care looks like, feels like, sounds like.
You know, and when for me, I'm of course very familiar with the concept of MIPA, given, you know, the work that I do. And it's stark to me that we keep having to remind people that this is important, right? Like, I feel like it should just be part of it. But having us talk about this, I think, will, one, let people know who don't know that this is a concept that really needs to be considered. So if this is work that they are doing within their own organizations or within their communities, this is a concept to always keep in mind as you are doing that work.
Yeah, and when you think about it, you know, a lot of people attribute MIPA to the Denver Principles, right? And a document, a manifesto written in 1983 by people living with AIDS in Denver, Colorado. And, you know, the statement, the opening statement of that manifesto says, we condemn the attempts to label us as victims, a term which implies defeat. And we are only occasionally patients, a term which implies passivity and helplessness and dependence upon the care of others. We are people with AIDS. So that was written in 1983. But when you think about it, the concept is not new. The civil rights movement was nothing about us without us, right? I mean, the Emancipation Proclamation, right? You know, everything, almost every civil rights struggle has been based on that same principle. Nothing without us, without us, nothing about us without us. And so you have to say to yourself, well, why would HIV be any different?
For folks that are watching this evening, is MIPA a concept that you are familiar with? Is this new information to you? So definitely comment in the chat. I'm really curious to know how people are coming into this conversation with us this evening. And I'll be happy to read those comments and have you weigh in on those, Malcolm.
Okay.
So, you know, Malcolm, you do a number of different things. And I want to bring in something that you recently wrote because I think it all ties in to this conversation that we're having. So you recently published an op-ed in Pause Magazine. So that was around election season. So election season is over now. What? So in that op-ed, you urge people living with HIV to stay in contact with elected officials. How important is voting and being engaged in the elections process for folks?
So for people living with HIV, as for people in general, voting is extremely important. My issue with the whole get out the vote efforts that have happened over the years is they are successful. They get people to get out and vote, but they don't tell people what to expect when they walk into the voting booth. You know, what struck me with the, you know, Raphael Warnock, John Ossoff race back in January was that a lot of people mentioned to me that this was their first time voting. And so they went in there and they knew, you know, because of all the ads and all the hype, what they were voting for. My concern is that after that experience, are they going to vote in 2022? And when they walk into the voting booth in a general election or in a primary election, are they going to know who those judges are? Are they going to know what those bills are? You know, voting is not just something that you do on election day, or if you're blessed to have early voting. It is something that you have to do year round. It is an effort that you have to make to study, to understand what the issues are, to understand where your senator, state senator, state representative, whoever, city council person, where they stand on the issues. And the only way to do that is to constantly stay in touch with those people. You know, when we founded PASAN, the Political and Social Action Network, we did that with voter education in mind. My goal at the time was we've got to make politics sexy. I don't know if I've been able to. I don't know if I've been able to do that.
Have you done that?
I don't know if I've been able to do that, but I do know that to a certain extent, I got some help from the orange guy. Right? I mean, it wasn't necessarily sexy, but he did make people aware of what's going on. But I want people to have that same engagement without that lightning rod, right? You walk down the street during election season and you see placards and signs on the side, Sheriff so-and-so, vote for this person today. We did we conducted a program at Thrive SS, and it was called AIDS Watch Out, right? And the reason we called it AIDS Watch Out was because that year, AIDS Watch had been moved because of change, and a lot of people couldn't go. It was virtual, so we decided to do something else as well and do some voter education. And one of the questions that we asked people was, "Do you know who your state senator is? And if so, name them." So everybody said yes, but then they all named Purdue. They all named Kelly Loeffler at the time, right? And so that let me know that they don't know the difference between their state senator and their U.S. senator. And no shade, no shame. That's the problem, right? Because if you don't know who that person is, then you don't know what they do. You don't know what power they have over you. And to bring it around to HIV, I'm also the co-chair with Eric Polk of the Georgia HIV Justice Coalition.
Yes. And
one of the things that we fight for is the decriminalization or the modernization of the HIV laws in the state of Georgia. And there are laws around the country. People don't know, but me as a person living with HIV and living with HIV that is under control, I am undetectable. I can, there is a concept called U equals U. We'll get to that in a minute, but it means undetectable equals untransmittable. If my HIV virus is undetectable, then I cannot spread my HIV virus to someone else that I have sex with. Now, if that is the case, then why can I be arrested for not disclosing my HIV status? And arrested with some of the same penalties as a person who was convicted of, assault, right? And so these are the things that we have to make sure that our community is aware of, and that our community needs to be able to ask their representative, hey, where do you stand on modernizing the HIV criminalization law?
Absolutely. Absolutely. And, bringing this back around, when we think about the meaningful involvement of people living with HIV, understanding all of the things that impact folks that are voting, for you is really incredibly important. And MIPA fits into that entire idea.
Yeah, it definitely does, because we are blessed in this country, no matter how horrible sometimes we think things are. We are blessed in this country. There are places where you cannot even identify as a gay man. You can't identify, and you can't be out of the closet saying that you are a gay man living with HIV. We are right now on the internet, and thousands, millions of people can see us, and we don't have to worry about going outside our door and being arrested for that. So, but as I always say, and I ain't the first one to say this, is an old cliche, freedom ain't free. And once you understand the freedoms that you enjoy, then it's incumbent upon you to understand how you keep those freedoms. The reason that these crazy voting laws are being passed is because the folks that are passing those laws know how valuable your vote is, and that's why they want to take it away from you. Right? They wouldn't be fighting so hard to take your vote away from you if it didn't mean anything to them, right? So they know, and that applies to people of color. At Thrive, and let me just move over here for a second. The organization that I work for, Thrive SS, Thrive is a perfect example of MIPA. Thrive stands for Transforming HIV Resentments into Victories Everlasting Support Services.
Yes.
And it was founded by 3 Black gay men living with HIV, Daniel Griffin, Dwayne Bridges, and Larry Walker. Our staff and volunteers and board are more than 50% people living with HIV. We have a network of over 4,000 people, both men and women, and people of all gender identities, gender non-conforming. We run the gamut. And our job is to support them. And the only way that we support them is to make sure that we hear them, that we listen to them.
This is actually a perfect segue into this amazing work that you do around the Silver Lining Project. And one of the things that I absolutely, let's put it in context. So people living with HIV, there's support that folks need as folks age, right? And I love, I'm going to make 2 plugs before I ask you this question. First and foremost, I want folks to go ahead, and we actually have an article in The Reckoning on the Silver Lining Project. Definitely go check that out. The other thing I want to mention that we have on The Reckoning is we are actually talking to city council candidates on The Reckoning. So you can read about folks. If you're in the Atlanta area, you can read about some of the folks that are currently the LGBTQ folks that are running for city council. So you can check that out. So the question, can you talk to us a bit about why you founded the Silver Lining Project and why that is so important within the community?
Yeah. So as a man living with HIV who was over 50, I realized how blessed I was. I have been in a committed relationship for over 24 years, for coming up on 24 years. Next month will be 24 years for Stuart and I. And that in itself is a blessing. But, at that time it was 18 years or whatever. So that in itself is a blessing. I had a great job with great insurance. Right? I was working for a major telecommunications company. I never worried about my medicine. I never worried about, any of that. But I kept hearing and meeting people that had to do ADAP recertifications every 6 months. That were going through all kinds of trials and tribulations to get their medicine. And we all know how expensive HIV medicine is. Just so that people know, the medicine that I take every day is $3,700 a month.
Wow.
Yeah.
37. So if you hadn't had that insurance, $3,700 a month.
$3,700 a month, right? So if you don't have some type of support, some type of insurance, Ryan White, something to help you, then you're just out in the cold. But it's not just the cost of the insurance, of the pills and everything else, but it's all the other, and excuse my French, it's all the other shit that you got to go through, right? You got to fill out these forms, you got to go here, you got to go there. I never had to do any of that, but I talked to people who were going through that. Then you're getting older, and like I said, I'm in a relationship, but I know many single men my age. And one of the things that I always say is, you're starting to look around and you're not the cute guy at the end of the bar anymore. And, that leads to a certain level of loneliness, that leads to a certain level of depression. And I knew that my brothers were going through all of that. And so I was like, okay, you've been blessed. What can you do? And so, I put that out in the ether, as they say. And a couple of people that I met on a cruise, on the SGL cruise, and one thing led to another, and I was invited to be a part of what is now Thrive. But prior to that, I had gone to several other places to see what was out there, and I just didn't see anybody that looked like me. I saw young Black men, and then I saw older LGBTQ people. But those people were not the same color as me. So I was like, we got to do something. So after being a member of Thrive for, a couple of months, I mentioned to our executive director, Larry Walker, I said, hey, I'm looking around and I don't see anything out there for me. And he said, create it. And at that point, I was like, what? Wait, what? What you talking
That's
about?
it.
I did my best Arnold impression. What you talking about, Willis? But yeah, and so I did, and got some help from some amazing people along the way. DC Branch took the group and did a photo shoot, and that started things up for us. DC and Joe Robinson are now my the coordinators for the Silver Lining Project. Nathan Townsend and Claude Bowen and I sat down and wrote the curriculum. Jerome Hoskins made it into a real curriculum, because that's what he does. And Larry Walker wrote the grant, and bang, we had the project. And so now not only do we do the Silver Skills curriculum, which focuses on HIV and aging. We have a course on HIV and aging. We have a course on PTSD and trauma, because we know that most men my age living with HIV have probably been living with their HIV for a long time. But not only that, you've been gay a long time, so you're dealing with that. You've been Black a long time, you're dealing with that. So we talk about that intersectionality, what that oppression has done, and how that is PTSD. And how that has introduced some trauma into your life. We then talk about loss, because a lot of us have lost friends in the 80s and 90s, but not only the transition of people, but also the transition of stages of life, right? The loss of a job, a job change, retirement, all of those things represent some type of loss. And then we finish it up with stigma. We ended with stigma because we wanted to introduce stigma. We wanted people to understand what stigma is and how it impacts you, but we also wanted to give them the tools to overcome stigma. And so after the stigma module, then we do a photo shoot and we do a retreat. And so our retreat this year actually is going to be on September 16th. We're going up to the Georgia mountains with everybody that has gone through Silver Skills. So there'll be about 40 of us up there. And we'll do that photo shoot. And not only that, but on September 18th, it's HIV and Aging Awareness Day. So we'll be able to put out some content over the internet about that as well. So yeah, I started the program. Thrive was started by those 3 Black gay men to save their lives. I started the Silver Lining Project to save mine and to save people like me. And it's been a blessing. It's like I said, I retired from a major telecommunications company, and with doing this in mind. So I guess the only thing that I'm failing right now, and my husband will tell you, the only thing I'm failing right now is retirement.
I'm going to say, how's retirement going?
Yeah, I'm not doing that too well, but I'm enjoying myself.
So I want to something that is coming up for me that is so critically important as we think about the concept of MIPA. All of the things that Malcolm just talked about could not happen if folks who living with HIV were not meaningfully involved in the creation of that thing to save the lives of the men who need it.
Exactly.
It couldn't happen.
Nope, it couldn't happen. It wouldn't happen. If there was no concept of MIPA, we would all be going to the doctor, taking our pill, going back home, and slamming that closet door and taking our pills and suffering in silence, because we wouldn't be talking to anybody. We wouldn't have those support services. Larry has a saying, there is no pill to build will, right? And so you can have all the antiretrovirals, and now we're coming out with the injectables, and we can do all of that so that you can live a full physical, healthy life living with HIV. But if you are still, I got to tell somebody I got HIV. I just met this dude. I tell him I could possibly, I can't have sex. I can't, if all of this stuff is going through your mind, when you're first diagnosed, most people living with HIV will tell you that when we're first diagnosed, every pain that you get, every sneeze is, oh Lord, it's HIV, it's AIDS. I'm gonna, if you are still living with that, imagine what that does to your psyche. We need people to be able to get together and talk to, and that's what we do at the Silver Lining Project. I mean, we have our OBA's roundtables. OBA is a West African word that means king, and so we have what we call our OBA's roundtables. Right now, we're doing them every 2 weeks at our headquarters. During the pandemic, we did them once a week via Zoom. But it's about getting in a circle of men who have that thing in common, that we can talk about it. And we talk about, not only do we talk about HIV, and most of the time we're not talking about HIV. We're talking about old man stuff. We're talking about retirement money. We're talking about dating, and we're talking about sex, and we're talking about anything that hits us that we want to have a conversation about. We get together and fellowship and talk about those things. And it really lifts the mood. I just did a presentation that I sent back to our funder, and I was almost in tears as I was doing it, because I was just hearing the voices of the guys talking about the things that the Silver Lining Project has done for them. And we get that from not only the Silver Lining Project, but all the guys at Thrive. Once you're in the network, people start to say how it helped them, because when you are given that diagnosis, you have to be able to have someone to talk to about it. A lot of people don't talk immediately, but you have to be able to talk to somebody about it, whether it's a good friend, whether it's, and not only that, not only talk to somebody about it, but talk to somebody and trust that business will not be out in the street, right? So that's the other thing. It's like, we're all Black gay men. We understand how messy some of us can be. Right?
That's real.
and so you have to pick your friends really carefully. And we have people in the group who have told us point blank, I only talk about this within this safe space. I don't talk about this to my friends. And we understand that. We understand that, and we're here for it. We're here to help you deal with it, and here to help you and coach you to the point where you can talk to your friends about it, where you can take a picture and be part of our I Thrive campaign, where we take pictures and post them on the internet, or we give you the picture and say, hey, do with it what you will. And, most people do post their pictures and say, hey, I've been, living with HIV for this long. I've been living with HIV for that long, because it's so freeing when you can do that. You can now, okay, the world, I don't have to hide. It's just like the coming out experience, right? Once somebody knows you're gay and you can come out, you breathe,
Malcolm, there's so much that we can talk about. So we're starting to kind of wind down. I'm going to ask this question, though, because I do think it's important, especially as we're talking about MIPA and the meaningful involvement of people living with HIV. For allies, I'm going to ask this question in two ways, actually. So how can allies continue to participate in the movement, in the work that you are doing in Georgia? And the second part to that is, what does Malcolm Reid require from allies coming to do movement work, from your perspective?
Help us eliminate stigma. You go to a Black barbershop. You hear dudes talking about gay men. You hear dudes talking about, oh, the gay guy walked in, he got AIDS. Stop it in its tracks.
Shut it down.
Shut it down. Educate. Those are the things that, because I was in a meeting today, and it was a small sample size, very small sample size. But we were going over an evaluation of a program, and 50% of the people that were in that program at the beginning of the program did not believe that if you were taking your antiretrovirals and you were undetectable, that you could not spread HIV. They didn't believe it. They didn't know it, and they didn't believe it. There were some other things that you would say in 2021, we're still facing this. But, we have to understand we're still facing racism. We're still facing all of the other isms because all of those things are perpetuated throughout our family structures. They're perpetuated in church. It's like everybody has these beliefs that are just not founded in fact. And so the only thing that we can do is say, you know what, I know this isn't true, and I can provide resources and links and things, but hey, and we know that a lot of misinformation is on Facebook. Counter that stuff. Just let people know, no, this is not true. Sometimes arguing on Facebook is pointless, but or any social media, it's really pointless. But yeah, if you have friends, if you have a friend who has a child who he says to you, yo, I think my son's gonna be gay, I don't know what to do about that.
Love him.
Yeah, love him. That's what you do about that. You love him, and when you think about the creativity and the things that people do when their minds are free of all of that bondage and stress, it's really amazing. Your son that's gay could end up being the president of the United States, but you're sitting there holding him down, telling him you want him to do something else, or you want him to be somebody who he's not. All of this gender non-conforming, all of these things, none of this stuff is new. It didn't somebody didn't sprinkle dust over the world and now all of a sudden we have all of this. This has been going on for a long time, but people were afraid to come out. People were afraid to talk about how they were feeling. And, a lot of people lived all of their lives with that fear.
Isn't that sad?
It's very sad. It's very sad. And, our job is to provide that platform that says, no, we're not doing this anymore. My allies, the same freedoms that you want in your life are the same freedoms that we want in ours. So spread that word. We are not trying to take over your children and make all your children gay. That is not my agenda. It's not anybody's agenda that I know.
Right.
And we're not trying to infect everybody with HIV. All of these things that we're not doing any of that. We are trying to stay healthy, stay well, and make sure that we have a normal, healthy sex life without spreading HIV, without the danger of spreading HIV. That's why we take our medicine every day, so that we can live long and that our partners and our friends can live long too.
Listen, Malcolm, I want to bring in this last comment. I'm wrapping. I promise. Okay. I'm wrapping up. But I do want to bring in this comment from Dorian Gray Alexander, just saying, hey, it's great seeing the both of us.
Hey, Dorian, how you doing?
And thanks for these narratives. Thank you so much, Dorian, for tuning in. And thank you to everybody who tuned in. Malcolm, Reid, I want to say this. I want to look into this camera. I'm looking at you. I love you. And I miss you, and I'm so glad to see you.
I love you, and I miss you too. And if anybody has any other questions, you can reach me at malcolm@thrivess.org. That's MALCOLM at thrivess.org. And also just reach out to us on our website, which is thrivess.org. And if you are right now in the Atlanta area, or if you just need access to care, thrivess.org/linkage, fill out the form, and one of our great linkage team will get back to you as soon as possible, and we'll get you hooked. We'll get you to hook up.
I love it. I love it. Shout out to Thrive SS. Thank you so much for being here tonight, Malcolm. And thanks to everybody for watching tonight's Revolutionary Health. I want to give another shout out to our host, Michael Ward. I am honored that I got a chance to sit in for Michael this evening. And I know he made it safely to his destination. So we good to go.
Right.
And
right.
So that's all that was important. And so for folks watching, please follow CNP on social media. We can be found at CNP CNP Tribe on Instagram, Facebook, and Twitter. And make sure you go on over to YouTube. Our YouTube channel is CNP TV. You can watch archived episodes of Revolutionary Health, as well as all of the other content from CNP. We are so grateful that you support us. Thank you so much for being here tonight for Revolutionary Health, and we will see you all really soon.
Awesome. Thank you, Johnny. Thank you, Michael. Thanks, Alvin. Talk to you guys later.
Thanks, y'all.
All righty.